The onset of erectile dysfunction also occurs between 10 and 15 years earlier in men with diabetes as opposed to those who don't have diabetes. Normal male sexual function requires a complex interaction of vascular, neurological, hormonal, and psychological systems. So that's a lot that has to happen before you even get to the point of an erection and sex. A whole bunch of things have to happen in synergy for that process to even happen.
And just to show you that I'm a good listener and I'm taking in this information, it was stated earlier that a lot of men experience erectile dysfunction or notice that they have erectile dysfunction before they actually ever go to check and see if they're dealing with something else like a chronic illness like diabetes, right?
Right. Correct. Good point, Sean. And so as we talk about the complexity of sexual dysfunction or sexual ability, let's get into it. Nitric oxide plays a significant role in your ability to perform or have an erection. High levels of nitric oxide act as a local transmitter and facilitate the relaxation of your IT. And it's a long word. So intracavernosal tuberculate.
Say that 3 times fast.
Spongy tissue. It's the spongy tissue in your penis. Thereby, it maximizes the blood flow and penile engorgement, which is in effect your erection. Nitric oxide is a big part of your circulatory system. It helps your body dilate and constrict your blood vessels. It can improve your blood pressure and thereby your heart health. It can improve also your exercise and muscle performance. And I want to say that because most people think the penis is a muscle. It's technically not a muscle. Again, it's a very complex structure. Going on, erectile dysfunction is the inability to get or maintain an erection firm enough for sex. This is common in men who have diabetes, especially those who have progressed to type 2 diabetes. And in last week's episode, I talked about pre-diabetes. This can also affect you at that point as well.
That's just where I was about to go. You noted that a lot of the symptoms for pre-diabetes are actually a lot more severe than a person might assume. So that's exactly the question I was about to ask you. Is this something that you can experience or at least start to experience in some capacity before you get that full diagnosis of type 2 diabetes?
Right. And that's what we talked about earlier on. This might be already happening before you get this diagnosis of diabetes because your body is already attempting to compensate for what's happening. And so ED stems from damage to those nerves and blood vessels caused by poor or long-term blood sugar control. Erectile dysfunction can also be linked to other conditions common in men with diabetes, such as high blood pressure and heart disease. And what we know is that men don't frequent the doctor's office. You are going to be hard pressed to get a man to go to the doctor unless he is in extreme pain. Something is hindering him from doing his physical work or moving. And because of that, a lot of men, especially men of color, are experiencing diabetes, high blood pressure, heart disease, having strokes, and suffering other issues at a higher rate than any other population.
And the issue with, another issue with ED is if you are in sexual relations with anyone else, that becomes an issue for not just yourself. And it can, what other ways does that outside of your own physical and mental health, like what other challenges can await a person, who's dealing with something this serious?
Well, having erectile dysfunction can be a real challenge, as you stated. It can leave you and your partner feeling frustrated and discouraged. It can cause issues in the relationship because of that frustration. So we're encouraging everybody to take steps to cope with the erectile dysfunction and to quickly get your sex life back on track so that you can have a healthy sexual relationship. There is nothing wrong with a consensual, healthy sexual relationship.
And sort of like I was saying earlier, people kind of look at sex and sexual dysfunction in the most shallow sense. So perhaps your partner, they may not assume you're dealing with a chronic illness. You said that could cause frustration and discouragement within your relationship. You know, there's a good chance maybe your partner's thinking, like, well, is there something wrong with me? Is it my fault they don't like me anymore? If they were with someone else, everything would be going fine, when it could have absolutely nothing to do with any of that.
Absolutely nothing to do with it.
So we've talked a lot about men, but women get chronic illness and get diabetes too. So they've got to be experiencing, or I'm assuming, it's very possible that women must be experiencing some types of sexual dysfunction as well, right?
Correct. And to Sean's point, it's a challenge. If a man or a woman is experiencing a chronic illness, they are very likely to be experiencing some sexual dysfunction overall, not just with diabetes. We're focused on diabetes, but any chronic illness, there is a lack of sexual desire. So women, you are not exempt from this conversation. The most common sexual dysfunction in women with diabetes is decreased sexual arousal and slow or inadequate lubrication. That happens as women age as well. But if you are experiencing diabetes, this is a very likely cause. Women with diabetes may experience decreased sexual desire and more pain with sexual intercourse, and orgasms may also be experienced less frequently.
And I would just like to quickly hop in, because I feel like things like this with women would be put to the side, maybe in a medical sense, but especially in a social sense, because there is this weird fake stigma that women are less interested in pleasure and in sex, which is simply not true.
That is not true at all. A point I wanted to make is, I would say men are more easily sexual aroused, but that does not mean that women are less interested in sex. We are highly sexual beings as well, and not to be inappropriate at all, but when things are working good and things are good, it's all good. And a woman might trump a man in that situation when all systems are go for everybody. We'll continue on with women with diabetes. You are also prone to the same blood flow issues men face because of that nerve damage and blood vessel damage that we discussed earlier. Diabetes complications may make it difficult for blood to move to the vagina and the clitoris. And those are the stimulus points, just in case anybody didn't know. Women in general report more difficulty having an orgasm than men, and those with diabetes have even greater difficulty. A woman's inability to climax often has to do with her mental or emotional state, and we'll talk about that later. But diabetes may also play a huge role in that. According to a study published in the Journal of Obstetrics and Gynecology, middle-aged women whose diabetes requires insulin is 80% more likely to report trouble reaching an orgasm than a woman without diabetes.
What's up with that?
Well, it is the etiology of the disease itself, but medication as well causes a lot of the issues. And we're getting to that point in this segment. The research is still very scarce when it comes to women and our sexual issues and diabetes. However, we know that both men and women are equally affected by sexual dysfunction when they have diabetes.
So what is it about diabetes? Why does it cause sexual dysfunction?
When your blood sugar levels are too high, less nitric oxide is produced. And this can mean that there's not enough blood flowing into the penis or the vagina or clitoris to get aroused or to keep an erection. Low levels of nitric oxide are often found in those with diabetes. Nitric oxide